Look at this mountain range. To the people living out here, a bad cough or a mild infection isn't a quick trip to the pharmacy. When the nearest clinic is miles away through this terrain, simple problems escalate into life-threatening emergencies. That's why the day for a rural logistics team starts before the sun is even up. Loading a specialized 4x4 transport is precise work. The drivers know that every winding dirt path on their route leads to a family waiting for care. Getting the vehicle over the mountains is only half the battle. Inside these crates are vaccines, and they are highly temperature sensitive. If they're exposed to the scorching summer heat outside the vehicle for even a short period, the active ingredients degrade and the medicine becomes useless. This diagram shows the cold chain. Active refrigeration units constantly push back external heat waves, maintaining a stabilized microclimate. But there's a strict limit. If the delivery doesn't arrive by 11:55 a.m., the clinic's power drops and the onboard batteries will run flat. The logistics team has just a few hours to navigate miles of wilderness before that thermal window collapses completely. Crossing this wilderness requires serious mechanical discipline. You can't just drive fast. You have to protect the fragile cargo from violent impacts while muscling a heavy vehicle over loose gravel, steep inclines, and washed-out riverbeds. And right when the clock is ticking, the June monsoons hit. Heavy rains sweep across the valleys, washing out primary roads and completely blinding standard cellular GPS signals. This is a topographical map of the vehicle's route. When ground towers fail, the dashboard switches to satellite-assisted navigation. By bouncing signals directly off orbital networks, the system instantly calculates a new, safe path around the blockage. The satellite connection feeds live weather radar and real-time altitude changes directly to the driver, ensuring they know exactly what's around the next blind corner. Tackling terrain this unpredictable takes a capable vehicle, but relying on that invisible tether to space is what gets the cargo through the storm. Beating the 11:55 a.m. deadline means the vehicle pulls into the clinic with just minutes to spare. The staff mobilizes immediately, transferring the sensitive supply crates out of the transport and into the facility. This flowchart shows how they keep the vaccines viable when the local power drops. The clinic utilizes an emergency solar backup. Sunlight is captured by roof panels and stored in heavy-duty battery banks. Even when the village power grid flashes offline, that stored solar energy creates a closed loop to keep the medical refrigerators running continuously. With the cold chain secured, the medical team immediately shifts focus. A local family, soaked from the heavy rain, arrives at the clinic. The patient's symptoms are complex and require a level of diagnosis that goes beyond what the small rural staff can determine on their own. To get that diagnosis, the clinic activates a secure telemedicine link. High-resolution X-rays and live diagnostic data are transmitted from the remote outpost directly to a specialist sitting in a city hospital hundreds of miles away. The rural physician performs the hands-on examination, while the urban specialist analyzes the incoming data streams. They review the patient's vitals together in real time, building an effective treatment plan on the spot. The technology doesn't replace the local doctor. It arms them with the diagnostic resources of a metropolitan hospital, directly at the patient's bedside. As the storm clears and the transport heads back toward the city, the numbers tell a clear story. The cold chain held, the vaccines are safe in off-grid storage, and critical diagnostic tests were completed on schedule. But beyond the data, there is a deep trust forming between these communities and the healthcare teams. The system works because the people driving it are committed to showing up, no matter the conditions. Now, logistics networks are expanding that commitment by deploying autonomous medical drones. These units carry secured payloads straight over the mountains, reaching isolated valleys that even a 4x4 would struggle to access. This digital map shows the infrastructure of the near future. The drones integrate with the existing satellite links and solar-powered clinics, turning isolated single outposts into a massive, unified healthcare network. A person's health shouldn't depend on whether they live near a highway. When human determination pairs with the right technology, the distance between a patient and the care they need simply disappears.